Thank you so much, Deborah. I really could not have said it better, and I'm thrilled to just be able to reflect with everyone here on just the power of listening, the power of community-based solutions, and also the joy, I think, that comes with the unexpected and what you refer to as pivoting. And I think as you hear a little bit about the work of this organizing committee, I think we have pivoted, and this work together has led us to unexpected and wonderful places. And it's an honor to be able to share some of that with this audience. So as Deborah said, I'm Ann Huang. I'm honored to be one of the co-chairs of this organizing committee. I started this work when I was the director of the Center for Consumer Engagement at Community Catalyst. And while I've since left that work of building power among communities to drive solutions in healthcare programs and policies has fundamentally changed how I view my work and my role and the world. And it gives me hope for rebuilding and for recovering from all of the things that have been laid bare over the past 2 years. And I look forward to being able to share some of the work of this organizing committee and the ways in which I think it can lead us forward. So if I think there may be some slides. The first thing I wanted to invite people to do is to take a minute and view this website, which actually, while this shows North America, it actually does have locations across the globe. If you would like to share with us where you are joining us, which native land you are joining us from today. I am joining you all from Boston, which is the native land of the Pawtucket. This is a way to help orient us and remind us of the space that we inhabit, literally and figuratively, as we approach our work and live our lives. So if you have time to join us, to share with us where you are joining us from today, we would welcome that. The Assessing Meaningful Community Engagement project has been a partnership between the National Academy of Medicine Leadership Consortium and the Robert Wood Johnson Foundation. It set out to identify measures that, as Deborah said, can look at a space that has long been thought of as squishy and try to create some structure with the goal of better characterizing, tracking, motivating, and guiding progress. And we hope that the tools that are being developed can help make community engagement really the norm, and to help those who are committed to community engagement make that engagement more meaningful and powerful. So what we're sharing today will be the conceptual model that describes the outcomes associated with engagement. There will be additional materials that will be released over the course of the year, including some impact stories about the power of community engagement, specific metrics that are aligned with the conceptual model, and later in the year, a special publication with additional background and materials. So today, our agenda includes a review of the Assessing Community Engagement conceptual model, a conversation on the use of the model featuring members of the organizing committee, and then we have a panel that will allow for some dedicated question and answer time with a panel of organizing committee respondents. So with that, I'm going to turn it over to Mona Shah from the Robert Wood Johnson Foundation to add her welcome and also give some more logistical information about today's meeting.
Great, thank you so much. Hello, everyone. It's so great to be here. As Ann said, I'm Mona Shah, Senior Program Officer at the Robert Wood Johnson Foundation. I'm in New Jersey, which is part of the ancient homeland and traditional territory of the Lenape people. So thank you first, Ann, for your leadership in co-chairing this important work. And thank you to the National Academy of Medicine for their leadership in developing the work and creating the space for today's conversation. At the Robert Wood Johnson Foundation, we're working to help ensure everyone has the best opportunity for health. And that requires us to listen and partner with people who are most impacted by inequities, so the solutions that we support actually work for their families and communities. For us at the Robert Wood Johnson Foundation, this project is so critical to help understand if communities that we work with feel meaningfully engaged, and to hold funders like us and other decision makers accountable to the communities we serve. As the National Academy of Medicine and the credible organizing committee developed this work, there was recognition that the model should be used to a broad audience. We all know that communities need to be more engaged and have more power and decision-making authority to identify what promotes their own well-being. That is why it's so important to note that this conceptual model is available and useful to a variety of systems who promote health and healthy communities. So regardless of whether you are in hospitals or clinics, working on housing or climate change, or conducting research or making policy, this model can be used to transform a range of systems that promote health, well-being, and thriving communities. So we want to make sure this session is as interactive as possible. So if you have a question at any point during the meeting, the Q&A button that is located in the controls at the bottom of your screen on the Zoom platform. We have set aside time at the end of the meeting for audience Q&A to address these questions live. And we'll use these questions to create a frequently asked question guide that will be available on the project website. And also, since we only have a short amount of time together and doing this virtually, we ask those participating in the meeting to please also feel free to use the chat function on the control panel to share your thoughts and insights. We want to hear from you about what you think about the conceptual model, what you like about the model, and how it could be better. A recording and copies of these presentations will be available to view after the event on the National Academy of Medicine website. So thank you again for being here. And let me turn it now to Aidola Nis, who led this project and part of the National Academy of Medicine Leadership Consortium, to start